Okay, we're good.
Amazing. Welcome, everyone. We are live recording this webinar, which is to select the provider for the St. Pete Community Support Hubs process. My name is Jocelyn Howard. I'm with the Pinellas Community Foundation team, and we have here a host of our wonderful external reviewers, as well as some staff. So we're going to kick off the meeting with a little bit of an overview, have everyone do introductions, and then we'll move into handing it off to the committee and allowing them to do their deliberations. So we'll start with some PCF introductions, and Duggan, I'll turn it over to you.
Thank you very much. Good morning, everyone. I'm Duggan Cooley, the CEO of the Pinellas Community Foundation. We're excited to see this process with the committee this morning get off the ground. I want to thank the committee for their involvement, taking the time to thoroughly review all of the applications for this process, investing the time on behalf of the community to do this. We appreciate you doing that, and then also spending time with us this morning to deliberate and make a decision about choosing an applicant. So good morning, everyone.
Good morning.
David, do you want to introduce yourself?
Sure. Hi, everyone. I'm David Bender, the Director of Grants and Operations, supporting the rest of the team here with process and tech. So happy to be here and excited to see the rest of the meeting. Dr. Reed.
Good morning, everyone. Dr. Stephanie Reed with Reed Community Consulting. I'm working with the foundation as the ARPA evaluation consultant. I'm happy to be here this morning to support the process.
Then Rose, go ahead.
Hi, good morning. My name is Rose Granted. I am the program officer for our ARPA programs at Pinellas Community Foundation. I'm honored to be a part of this process, and thanks for being here.
So this is an overview of what we'll chat about today. Our team will give a little bit of a background around ARPA and the community support hubs. This is information you all know, but we just want to repeat it so we're all on the same page. We'll ask our committee members to introduce themselves, and then we'll have time for the deliberations for the rank and review and selecting the lead nonprofit. We'll have a brief opportunity for public comment for any items not on the agenda, and then we will wrap up. So to give a little bit of context around what we're doing today, Pinellas Community Foundation is really grateful to be collaborating with the city of St. Petersburg on this process to really open an opportunity to the community to design and create services that are informed by our community needs. So this is the fourth public-private partnership that we've been trusted with, and we're really grateful to be here today. So also moving into a quick overview of the American Rescue Plan Act, or ARPA, which is where the funding comes from. This was an economic stimulus legislation passed in 2021 in response to COVID-19. And some of this money was distributed to state and local governments to aid in pandemic relief. So the money must be obligated or kind of designated for where it's going to go by the end of 2024, and it must be fully spent by the end of 2026. So St. Petersburg allocated about $8.5 million of its total ARPA funding towards this community support hub and shared services support for nonprofits. And this is what we're partnering with them to make happen. So again, just the what of this process of these community support hubs. We will have one lead organization, which could apply with up to 2 other core partners that will be chosen to design and operate these hubs and offer the core services. And the core services are listed here, just to go over them again. That's licensed care from therapists, neighborhood outreach, and then case management services. And another thing we want to note is that those are the core services, but there will be additional services that lead nonprofits will identify based on the needs of each neighborhood where the hubs are located. And the hubs will also have some funding in their budgets for emergency funds to quickly take care of crisis situations for residents. So the goal here is to strengthen the capacity of a vendor that is already doing great work in St. Petersburg, that is already well connected and already providing some or all of these services. So again, just a reminder, especially for our committee members, that there is no expectation that the lead will have huge capacity. So the capacity and infrastructure will be able to be strengthened through the nonprofit incubator program, which will come a little bit later. So that's just a reminder for you all that we really have this goal here of identifying the provider that's the best fit, regardless of whether or not they have the capacity tomorrow to roll out the hubs. So this lead vendor team will identify what the community needs and create services accordingly. And we are emphasizing that the services will be culturally appropriate, culturally responsive, again, to the needs of our St. Pete folks. And that this is an iterative process. So the hubs will open one by one. We will learn as we go. The lead nonprofit will adapt and evolve the hub model based on the learning. So again, just going into the intent of the application here, which is really to understand the provider team's approach to providing mental health care to people in St. Pete who are under-resourced, often communities of color and those experiencing trauma in St. Pete. So we designed this application to show the provider's vision and plan, which they have developed based on their excellent firsthand experience in the community. We know that it's going to be really important for this provider, whoever our committee chooses, to build trust and address the stigma around mental health care. And we've asked that if providers applied as teams, that they show how all members of the team really will participate in the hub process and show a collaborative design. So we're now going to move to committee introductions. Again, we really want to thank all of these committee members who put in a lot of time and expertise into this effort. So we're going to ask each of you to share your name, share your area of expertise, whatever that means to you, and just verbally affirm that you have no conflicts of interest in the process. So I'm going to start us off with Marcus Brooks, who is also our committee chair today.
Good morning, everyone. Thank you for the opportunity to be a part of this process. As Jocelyn stated, my name is Marcus Brooks. I have the opportunity to serve as the executive director of the Center for Health Equity, fueled by the Foundation for a Healthy St. Petersburg. My work and the work that we do is really focused on and steeped in advancing racial equity to ultimately improve the overall health of St. Petersburg. And so I love this work. I eat, sleep, drink, breathe this work. Excited to be a part of this conversation with these amazing committee members and looking forward to a robust discussion. Thank you, Jocelyn.
Now on to Natalie.
Good morning, everybody. I am very excited about this opportunity also. I am Natalie Cuddy. I'm the Executive Director with Family Enrichment Services, and my expertise is providing trauma-informed counseling and mental health services in our community, and I do not have any conflicts.
Thank you. Kimberly.
Jocelyn, I noticed I did not remind everyone that I do not have any conflicts as well, so thank you for that, Natalie. I appreciate it.
Thank you.
Good morning, everyone. My name is Kimberly Rogers. I am an attorney. I'm the executive director of Community Law Program. My organization provides free legal services to the poor, folks who are tenants and are at risk of eviction or going through the eviction process is a lot of the work that we do. And that's generally where my area of expertise comes in. I'm also on the board of governors of the Pinellas Community Foundation. I do not have any conflicts.
Thank you so much. Carrie.
Carrie, we're waiting for you to introduce yourself. I know your internet's a little wonky.
Good morning, everybody. Sorry, it seems that my video and my audio can't work at the same time. I'm Carrie Boucher, founder and director of Nomad Studio. My area of expertise would be youth outreach. And we do art with kids in the community, with many kids in the community, and focus primarily on system impacted youth. And I have no conflicts. Thank you, everybody.
Thank you so much. Virginia.
My name is Virginia Irving. I have a doctorate in early and middle childhood, and I have been an English teacher. And most of all, my passion has been for advocating for young children and supporting their growth and development in the best ways possible. I am retired, but haven't really retired, but maybe it's time. And I'm very happy to be a part of this process. And certainly I have no conflict of interest.
Thank you so much. And Carla.
Hi, this is Carla Bristol with St. Pete Youth Farm, and my area of expertise would be certainly community engagement as well as youth development. And equally, I have no conflict of interest, and I'm excited about the process and the outcomes that we'll experience as a community.
Thank you so much. And I will pass it to David before we move into committee deliberations.
Great. So now we'll be accepting public comment for any comments that would like to be made about the hub provider selection. If you would like to make a comment, you can raise your hand on Zoom now, and you will have 3 minutes to speak. At 3 minutes, you will be muted. Not to be rude, but I will press the mute button. Okay. We'll start with, I'll let April Lott speak, and then if anyone else attending wants to make a comment, we'll go in the order of raised hands. So April, you should be able to unmute yourself now, and I'll start the 3 minutes.
Good morning. I just wanted to say that I too am very excited about this process. I am grateful to each and every one of you for participating in the process. I'm eager to see the outcomes, as Carla said. I think this is going to be amazing for the people of the city of St. Petersburg. And I just wanted to say thank you to each and every one of you for doing this. And to the city of St. Petersburg, right, for allocating the funds, because of course that's the first step. There's a lot of money being across the country, and the fact that the city of St. Petersburg prioritized addressing trauma in their community is just about the best, most inspiring thing, right, that a city could do. And so I want to acknowledge the city of St. Petersburg for making that choice as well. That's all, David. Thank you.
Great. Thank you. So I'll give about 30 more seconds to just see if anyone wants to raise their hand. Okay, I think we're all set. I guess pass it over to Marcus now, and I pop up the scores. Does that sound good? Okay, great. I will share the screen now. And the way this is broken down is by the rank of the organization, the average score they received, all the committee members' scores averaged together, and then the recommendations in terms of highly recommend, recommend with some reservations, and do not recommend.
All right. Thank you. Thank you, David.
And also just let me know when you want me to pull down the screen. Just say stop screen sharing and I will.
Great, thank you. So I think we'll stop screen sharing once we get into some of the discussion, but I want to give people a moment to take a look at the scoring summary. One thing I will also do during this time is just remind our committee members that we may ask questions. I know Jocelyn shared that at the top. but we may ask questions of the applicants, and then applicants will be given 3 minutes to respond. So I just wanted to keep that in mind as we talk through this. There is an opportunity for us to get some questions answered. As you all will note, we see a few votes that say recommend with some reservation, and I'm sure that will bring up some questions. So please, if you have those, begin to think about what they are. And in no order, I know I see the 1, 2, 3 ranking, but I'd like to maybe get us going in the conversation and starting with Suncoast Center with an average score of 78 and the 2 votes highly recommend. Without reservation, 3 votes recommend with some reservation, and 1 vote do not recommend. So I'm going to open up the floor to the committee members to kind of talk through your thoughts on this application and share what came up for you during the application review process. So if anyone would like to speak, I could kick it off, but I'd rather not. And feel free to just bring your voice in. I see Virginia, you're off mute. I don't know if you want to, Kimberly as well. Y'all really gonna make me speak?
I'll speak. I was trying to find because I was on the Will application, but I'm looking at Suncoast, and of course I feel like this was a very strong application, but I was concerned about the diversity, of course, of the leadership of the organization, as well as it didn't seem to me that trauma-informed therapy was discussed as part of the entire gamut of mental health services that the organization provides. It seemed like it was limited to some services surrounding children. And I want, if someone is here who could talk to both of those issues, diversity and trauma-informed care, I would appreciate it.
And do we have representation from Suncoast Center on the call? Awesome.
Yes, we have Kristen.
Hey, great.
So should I unmute?
Yeah, so Kristen,
Okay,
I
great.
see she's got her hand up as well. So
Perfect.
Kristen, I'm sure you heard the points that were made there, but just around representation and leadership and for the BIPOC community, as well as trauma-informed care and youth support.
So thank you very much for all of your consideration, and we really appreciate being considered. And first, I'll speak about the trauma-informed agency, because we are indeed a trauma-informed agency and train all of our therapists in trauma-informed care. It is absolutely not limited to children, although we have some very specialized programs for children. We work really hard to make sure that it is not just therapy and therapists that are trained in trauma-informed care, but everyone in the entire agency, because that is, of course, really important to us. And it is important to the wellness and well-being of our community members and the people that we serve. In regards to our diversity of leadership, well, Barbara Dare is here with me. I'm going to actually let her speak to that, actually.
Hi, it's nice to see you all, and thank you for this opportunity. For the board and the leadership of the organization, we do have diversity in many ways. We are diverse in the experiences we've had in our lifetime. Every one of our members, maybe one has not experienced some sort of mental health illness, sexual assault, or some type of abuse or trauma in their life. We work hard to bring people of color into the organization And at any time, you might see more in leadership. We've had a lot of turnover over the last few years, which has made it very difficult. We have an extra effort to try to reach out to the BIPOC community to bring more therapists and staff at every level in. And we are really focused on that. We have a new potential board member coming in that is a person of color. We are getting ready to meet with that person soon. So we work very hard to have diversity, but we have diversity of age, experiences, and a variety in every area. So please ask any follow-up questions you have.
And we hope that's helpful to you.
Yep. Kimberly, do you have any follow-up?
No.
Okay.
Marcus,
Yes, Virginia, please.
I'd like to make some comments. I'm just getting acclimatized to what the process is. I think I have it. Thank you.
Yeah, thank you.
But I'd like to just look at the comments that I made, and I felt that this grant was extremely well written. Their responses provided a thorough understanding of program design, honesty in application, and high-level competence based on the application content. The history of their services and impact on the community is strong. Would see this applicant as an excellent lead. Their partnership history would allow great engagement and access around St. Petersburg.
Thank you. So any questions, Virginia?
No questions. No, just that. Thank you.
Thank you. Thank you. So I don't know if anyone else on the committee had their hand up. Doesn't look like it. I had some thoughts, and I would love to share with the group as well. And I appreciate everyone's thorough sharing thus far. So I felt like the organization was clearly able to communicate their history in community. I struggled a little bit with the explanation of the demographic makeup. There was a part in the application where it was shared that your service breakdown was 63% white, 32% BIPOC, and 5% other race. But then you went on to share that the Suncoast Center served individuals of all ages. 78% were adults, 22% youth, and then 12% Hispanic. So the Hispanic part, for me, would have fit into the BIPOC community and not separate in a way of. And so there was this question for me around cultural competency throughout the experience. You had, obviously you touched on the board leadership part, but then also the center management team being 87% white with 13% BIPOC. So that kind of stuck out to me. Lastly, there was down further this use of the term urban communities. And again, I'm curious around what is the cultural, not so much competency, but responsiveness that is built into the organization, being that you will be working intentionally with marginalized communities and many people of color in the work. So if you all could just kind of speak to the cultural awareness practices, competency practices, and then ultimately responsiveness that you all have either implemented or plan to implement in the future.
Is this a question for Suncoast, Marcus?
Yes.
Okay.
Well, thank you very much,
please.
Marcus.
Thank you.
Thank you very much. So the first question in regards to Hispanic being listed. So yes, you'll find that they're listed in different places, and just, I'm going to say, because of our different reporting that we do in different places, that we do have that separate in some areas and together in others. And when we were talking about BIPOC, that was indeed including the Hispanic. And when we're talking about, and then we separately list that. So in regards to how we serve different areas, different neighborhoods, different cultures, different, all of the different diversities, if you will. We have a lot of partnerships, and we listen. because one of the most important things, I'll give an example of right now we're working, we lead up the Zero Suicide Partners of Pinellas. And we have currently 3 different subgroups on that. One is our LGBTQ. And what do? Is we partner with everybody that we can that is reaching that population. And we welcome the voices and we listen to what they're saying. And then we use that to guide what we're doing differently. One of the ways that we are doing things differently because of that information is that we are better at accessing our individual therapists that are from the community in question than we ever have been in the past. The same thing with a BIPOC, the same thing with making sure that languages, when we can match and when we can't match languages, we do have both language line, a video conferencing option for our language line, and then the different forms of sign language. But the most important thing is to listen. And based upon that, in the individual communities, then changing up our services. We've done the same thing with our forensic services, listening better to what's going on for folks that have been involved in, negatively involved in the legal system, and making sure that we are addressing what their true actual needs are today that are way beyond the trauma and the mental health services or the case management.
We also are in all the neighborhood centers across the county, including St. Petersburg, and we are at the school.
So that was 3 minutes.
Yep. So
Right.
it's like
Yes.
3 minutes. And I noticed committee member Carrie, you have comments, thoughts, please.
Yeah, I have a question, actually, a follow-up question on the listening. And I agree that listening is very important. But I think the action that you take after the listening is kind of key to how that listening helps. Do you have a way that the listener or the people who are providing you with feedback, the community members and partners, are actually involved in the decision-making after the listening? Or is your leadership team making decisions based on the listening? Thank you.
You answer based on this.
So am I on mute or not?
Okay.
Oh, okay. Yeah.
We can hear you.
Okay, excellent question. And this is something that we've been working really hard on in the last year or so. And one of the ways, again, one of the examples I'm going to give is through our Zero Suicide Partnership. And what we have done is we have collected that feedback, and then we feedback that back to the same community and say, okay, this is what we think we ought to do differently. Are those the right actions? And so we've been going back and forth on that. We've got a fantastic strategic plan that is in the process of getting laid out, but it is defining our next steps for that process, because I will tell you right now, suicide in Pinellas County is a very big deal. And it is not the people that are reaching out for behavioral health services. It is everyone. And that is what this whole process is about, reaching out to.
There is a lot of loneliness and disconnection with community, and that's a key part in what we want to do. After the listening sessions, we also send out what everyone said, as Kristen mentioned, but we also send out follow-up surveys that are confidential, and we gather more information, and then they bring more people. And we have had multitude of listening sessions across the county on various topics. We work with veterans, we work with all target populations, all ages. We think seniors are often neglected in all populations across the area. So we work very closely to make sure that we give people what they want, because they won't take the service or use it if it's not effective.
And thank you for recognizing that it's the action that comes after the listening that is the most important. So thank you for recognizing that.
Thank you. Committee members, any other questions, comments, thoughts? And I will just quickly add, I appreciated your detailed outline of your current involvement in services outside of just the basic offerings. You all did a very good job of listing those clearly in a detailed way, so thank you for that.
Thank you.
All right, so if we have no more questions, we are going to move on to another one of our applicants. Let's go to New Visions of the Well. And so I will again open the floor. You all see the average score there, committee votes and recommendations. And I will open the floor to the committee for thoughts, comments, and questions for the applicant. Carla, yes.
So in reviewing this particular application, it was clear to me that there was a great understanding of what was being asked for the hub model. So that's what, and then the partnering organization was also strong in that area. But I felt like the lead organization had a lot of the core competence that we were looking for. The question that I do have, and the one area of concern I had, was actually as it related to outreach. So I felt like the allocation for outreach was a little low for me. So I wanted to understand, and since outreach was one of the core requirements, but that was just my only concern in terms of trauma-informed care. I felt like that was clearly identified that they provide that service, as well as being culturally appropriate. But the outreach was the one area that I was needing to hear directly from New Visions for the Well about.
And
So
so
if someone from New Visions I see could raise their hand. There we go. Okay.
First, thank you so much for taking the time. This process has been amazing to walk through and think through all of our community partners. Everyone who has submitted, we've had connection with. Responding directly to the outreach question, we only could list 2 partners, but I will tell you, embedded with all of our organizations, we have designated a person to be specific to the outreach for the hub model. In addition, we have another partner that we will be working with that is on the list of additional partners that will be supporting us with the outreach and engagement. They could not be listed as a formal partner due to the restrictions of the application.
Thank you. Carla, any other thoughts?
Just real quick, it was
please.
where it came up for me was when reviewing the budget. I saw, if I remember correctly, it said maybe 18,000. And so that's where, when I looked in comparison to everything else, I wanted to fully understand how that, that 18,000 could be effective for the outreach that would be necessary to make this successful.
Absolutely right. So they're embedded within the Wells budget as our contracted people.
Okay, thank you. Committee members, any thoughts? I'd love to hear all voices. Yes, Carrie.
Oh.
All right, I'm going to see if I can do this with my camera on this time. This is just a clarifying question in the outreach, intake, and care section. The case study was great walking through. And one of the questions is building awareness among potential clients. And in the second paragraph, Amanda regularly sees advertisements for the Wells Brunch of Us and Parents Cafe. I'm just wondering where those advertisements are. Are they on social media? Are they print? Are they at churches? Or just an idea of, how is awareness being raised and what format that is? Thank you.
Absolutely. I also have another partner who wants to jump in too. So it is through social media channels. They are also listed through our newsletters. It's also listed through our community partners. So we don't have events solely on our own. With greater capacity, it allows for greater ability for mobilization of our community members to be able to get the information out. So that is the way that Amanda finds out. She's has multiple connections throughout the community, all about her strengths and brilliance, so that when she is in need, it is a place where she can go and get the support.
Thank you. Anyone else? Yes, Natalie.
I really enjoyed reading all three of these applications, and everybody's thoughts were fantastic. For this application, I guess my biggest question would be, I know in the application, everything was explained thoroughly and with lots of information, but can you, with the well and partnering with PERC and Gulf Coast, can you talk a little bit more about that partnership and how it's going to be cohesive for the hub?
Absolutely. That was the bulk of our partnership conversations, because we are all doing very clear things. However, PERC has done the work of working with individuals who are impacted by the criminal legal system. They have done the work in getting the CARF accreditation in order to have approved services that is acceptable for people to be able to navigate systems that they are often caught in before they get the help that they need. So PERC as that partner, when they go through the hub doors, when we do the outreach, as soon as we hear that they are system impacted, they are immediately partnered with that organization. The city has already seen value and made significant investment in the CALL program. We know that serving in St. Petersburg, we need a location for those folks. And if they're going to get continued services, they need folks who actually represent the community they're coming from. So 2 criteria to be able to connect. Either you're coming through the CALL program, you're calling in after hours where CALL is going to pick up the phone and navigate through all of those resources, or you score high enough to let us know that the likelihood of you having contact with law enforcement, we then connect with the provider who will help to navigate through that system. No matter who you are, you automatically drop into the well. So from day one, you have access to drop-in resources, therapy, care management, specifically those who have been impacted by crime and violence. So that is why our partnership makes sense. We're already touching the systems, so we decided to work together.
Thank you.
Thank you.
Natalie, any other follow-up questions?
And Marcus, Michael Gelazzo is also here. There's about a minute left of time on that particular question.
All right.
You guys know me. I'm going to try to do this in less than a minute. Good luck. I think that what LaDonna said is correct. What's really driven this is how our organizations will work together and already do, and the growth of what we're doing in outreach. Because on the previous question, we probably do 4 or 5 events under Hidden Voices throughout the community already. This will help us expand that. But we've worked closely directly with the well, with Gulf Coast, and we see that this unique model of being able to do this more after hours and really have that intensive level of service for case management for not just the criminally justice involved, but across the spectrum. We all fill these unique roles, but we're actually all able to collaborate together and are very excited to see this move forward.
Great. Thank you, Mr. Gelazzo. Yeah, and I'll share some thoughts. I appreciated this response to the RFP. I appreciated the knowledge around case models. It was very clear. The use of the term cultural responsiveness not only spoke to competency, but it gave insight into how the organization already interacts in community. The partnerships were obviously strong. 83% of the applicant board members living with a physical or mental illness spoke directly to a connectivity between the work and the individuals asked to lead. I appreciated the hub design, the drop-in model as it was explained really speaks to this opportunity to build community. One of the questions I had, and this may not be the time to answer it, it may take a little bit more thorough, but seeing the responses thus far, I might actually get a response. So I had a question regarding the models that were outlined. I would have loved to learn more about the deployment of the specific cases and frequency of usage. What are you all seeing the most of? And how might this hub model support the needs in the community? So I know you had outlined a plethora of the different ways in which you support, but of that, which ones are showing up the most, and how might this ARPA funding support that? Yes.
Am I muted?
Nope.
Okay,
Yep.
wonderful.
Yes.
So I think that's the beauty of each one of our organizations. We see something different. For the well, the reason why we shifted our traditional model is because folks will drop in and use a consultation model, or they are actually in high crisis and need immediate support. So we see the bulk of our individuals who are coming for help, either immediately after something has happened, or something is about to happen, like eviction, arrest. And that is where we believe most of our services will happen. Other places are when people feel stuck in just general service navigation, things that would normally not take some individuals much time, like filling out a food stamp application or filling out the housing application. When individuals are in threat of housing displacement or being unhoused, it is hard to do the simple things like gather documents. So we see there's going to be a bulk there. I'm going to shift over to our colleagues because I want to say other system touches is where we're also getting people coming in. So when child safety is involved, they're calling, right? They're calling because they are scared. After an immediate arrest, they're calling because they're scared, or their bell's been calls because they're scared. So those are the ways that we imagine in the beginning, people continuing to get in touch with us. And then as we expand, we imagine those things will shift over time, just like all programs do. Mike?
Okay. Look, I guess getting back specifically to your question, Marcus, I look at, the number of people who come through our doors, and I think that this might be a way to answer this. And maybe I think Nicole's on from Gulf Coast, but when we look at the number of clients who come through our doors, whether it's through our substance abuse contract with the Department of Corrections, we're seeing plus or minus 300. We've served more than 70 people directly with services and hidden voices, and we'll serve between 45 and 60 just in our tiny house programs. Just those 3 programs alone, we're making referrals as is. And what the hub design will allow us to do is to make those referrals directly, like, for example, directly to the well for mental health services and treatment, which is something kind of going to the broader picture of ARPA and the pandemic. We've seen a dramatic increase of the number of clients who are actually asking for or receiving treatment services, even in programs like Cohorted Champions. So we're seeing that across the board, and this will allow us to really give us the resources to expand that, but expand the idea to a trauma center that we can deal with this on a bigger level. Because if I have 60 people who come through tiny house, that's not necessarily 60 people who were able
that's
to
3
provide
minutes.
treatment for. Sorry.
That is time. Thank you both for your responses. Anyone else from the committee? Any thoughts, comments? Yes.
I also thought this application was well written, very thorough response to the hub design. My question is, as it relates to the demographic section, people served, and the history, I didn't see much discussion about services to the elderly, members of the LGBTQ population, and so I guess I'm wondering, because, well, let me go back to the elderly. When you're talking about people who are at risk of homelessness and needing services, the elderly are certainly vulnerable, a lot in that space and area. And so how can you talk to the degree to which you have been involved with serving those populations, and whether or not your services are different in light of some of the particular needs of those populations? And then a second question has to do with the clinical discussion. Can you define clinical supervision, and then tell me, because I didn't see much discussion about what you currently provide to your therapist in terms of supervision?
Thank you so much. So we're going to have a team approach to this. I'm going to take the supervision first. Number one, I think we talked a lot about our supervision process. So not only do we provide weekly supervision for our own team, but any individual who is working in the field has access to our supervision groups, because that's a part of our training and development component. So if you're looking in training and development, we're offering supervision, especially for licensure. I'll take a point of privilege to say we just released 2 brand new licensed individuals into the field. Second, we're one of the only practices that offer reflective supervision, which thinks about how you as a human being are impacted by the work, how it is weathering to your spirit to see someone who looks like you, has similar experiences to you, being impacted by the same systems that you are. So we offer reflective supervision. We also have peer supervision and consultation. So that's for supervision. In addition to that, number one, we'll name our partnership with Seniors in Service. We work with them. We also have a smaller budget right now that does not allow a single focus only on elderly. So we are working with the family, the entire family system. And that is a point where we can do better with capturing the data around our elderly population and the specific services that we're providing. However, the strength of our relationship with Gulf Coast and their work specifically with elder population is really going to be leveraged there. So Gulf Coast, if you would like to share some of your elder program, that as individuals enter through the hub, they have direct access to all programs for all 3 collaborations.
Are you able to hear me?
Yes, thank you, Nicole.
Okay, yeah, not a problem. Yeah, I'll add to that. Call program has a lot of interaction with the elderly right now. We've actually seen a heightened need there. So in addition, our elder and disabled services through Gulf Coast, we have community care for the elderly case management services in Pinellas that is serving the St. Petersburg area. And we have homemaker services as well. So Gulf Coast has embedded 3 or 4 different programs in Pinellas County alone, servicing elder services and supporting call.
Is there enough time for me to add just a comment to this?
Yes, and we'll give a little extra time. There are 2 questions here,
Yeah.
so go for it.
So in addition to what Nicole said, and you know, and everyone on this call, if they don't know, should really know the depth of the programs offered under Gulf Coast for seniors. But I met with Anne Marie Winter last week, who's the executive director of the Area Agency on Aging. And I think I'm comfortable in saying that, you know, part of our discussion was really looking at strategic planning for seniors and expanding things like affordable housing and other services. I think that what you'll find is there's a real depth and genuine commitment and a recognition of the absolute need that seniors have in our system throughout. And Doug and I mean, I look at everyone on this call and we all know the crisis that we're having in affordable housing for seniors who are trying to stay on their own. This is something that's really embedded in all of our agencies as we collaborate on this hub process going forward. And I think it's a great question. And I just wanted to emphasize that if that's something that didn't come out, it should, because that's really a focus for all of us.
Thank you. Anyone else from the committee? Any thoughts, questions for the applicants? Carly, yes.
Just one other thing I wanted to list. I also, in terms of the board diversity, I did want to better understand that I felt like the board was lacking diversity in terms of, to be more direct, definitely maybe male of color on the board. So perhaps Dr. Butler could speak to that.
Thank you so much, Carla. You're right. When we initially formed as an organization, we had a much larger board. We decided to become lean in order to make some pretty significant decisions about operations, with the opportunity to have all of the structure to then invite additional people in. I was raised, don't invite people into a messy house, get lean, do what you need to do, and then invite individuals to continue to help build and develop. So that process actually leaned out our board. We are expanding it, especially as we have some foundations laid now that we've done some work.
Thank you. Yeah, Kimberly. Yep.
Oh, no, sorry.
Okay. Yeah, and then also when we think about just BIPOC communities overall, how you engage with other racial identities in a leadership capacity to impact the group that you are working to ultimately partner with, I should say. So I don't know if we have any more questions from the committee. If not, we will move on to our third applicant, who was Reach Services, DB, doing business as Reach St. Pete. And so would anyone on our team like to kick off their thoughts? I noticed, and you all will probably notice as well, with 5 votes recommended with some reservations. I'm guessing there's some questions that you all will have and we will want to have answered. So if anyone would like to kick us off, that'd be great. Natalie.
Hi. Again, I really enjoyed reading this application, and seeing the commitment to the community by these 2 organizations was really awe-inspiring. So thank you very much. My one of the questions I have is for clinical supervision. In the application, it talked about biweekly meetings, but can you give us more information on what clinical supervision looks like and how you support your clinical staff, please?
And I believe we have representation. There you are. Yep, floor is yours.
Hey, can y'all hear me?
Yes.
I would invite you to unmute Zanita from New Vision Behavioral Health to specifically answer this question.
Hi, thank you for your question. As a clinical supervisor, I supervise a team of clinicians. Bi-weekly, we do individual supervision to where we're meeting one-on-one. We're going over their cases. We're going over theoretical approaches they may be using. We're looking at any possible referrals that that individual or that family or that child may need. So we're providing ancillary services. They're often, we look at videos together. We do, we co-facilitate groups and also individual counseling. So that way there's that modeling approach to where they are not only providing the services, but they're also seeing how I do it. In addition to, we have peer supervision to where we will all pile up in one room and we will just talk about our cases. A lot of times we also unpack some of the things that we're dealing with on a personal level and how we don't allow that to show up in our work. And so that's how our clinical supervision looks.
Thank you. That was very helpful.
Absolutely.
So I also thought this was a very well thought out, thorough response. I appreciated a lot of the service provision, clinician support, and history of trauma information that you all shared, speaking clearly to your organization's history and community, and successfully highlighting the service area that impacts BIPOC communities. I did have a question for you all when you think about strength. So I think in the application, my experience as I digested was that the strengths were clearly listed with Reach St. Pete. And I was wondering in that partnership if New Visions would be able to speak a little bit more clearly to the strength that you believe stand out with your organization, and then how those two mesh together to create a valuable partnership.
Absolutely. I would like to say that both Reach and New Vision, although we are very modest-sized organizations, we do big, impactful work. We are very strategic with how we go out into the community, the populations we serve. One thing about New Vision Behavioral Health is that I recognized very early with starting the organization that in order for me to reach my community, I needed to be not only accessible, but also provide, be accessible by way of insurance. We recognize that Florida has a heavily state-funded or Medicaid insured population. And so we knew that in order for us to really do community work, that we needed to accept insurances that the BIPOC community actually had. And so we take Medicaid and we offer those type of services. In addition to, we're able to provide services to the community at no charge. With the number of graduate students that I have with me who are unpaid workers, we team out together in order to provide groups and also individual counseling services to our community with no charge. We are also able to connect with organizations who have access to these individuals who may be in need of services. We don't always call it mental health. We like to look at it as social emotional wellness that is less stigmatized in a lot of communities, but it still has a mental health approach. And so we're very strategic with how we provide wellness services to our community. We not only serve youth, we are very heavy with serving youth. However, we look at the internal family system, we serve families as a whole. And so I think that is a strength for us as far as how we reach out to organizations who may be in need of our services and how we're able to provide long-term care by accepting all insurances, including Medicaid.
Thank you. Other committee members, any questions for the group or comments about what you experienced in reviewing? Yes, Carrie.
I have a question. It's in with the payment for services section, and it's collectively we've determined that 1 year of service it would be $195,000, which would include a 50-minute counseling session serving 300 individuals annually. Is that? And then I saw that carry over to the budget. How was that? Just to be clear, that 300 individuals is what you all anticipate being able to serve in the first year of service as a hub. And if that's the case, how was that determined? How was that number decided upon?
Yes, so we looked at that being individual counseling sessions in addition to groups and workshops. So we looked at what it would cost for us to pay a clinician to provide these services in addition to, again, 1 or 2 groups a week and 9 to 12 mental health workshops a year.
And the 300 served per year or in that first year, is that based on your current capacity, or what is that 300 based on?
Yes, that's based on our current capacity and trying to be practical with, the time it may take to do the outreach and to really get the capacity or the numbers that we would like to target. So we didn't want to be grandiose with the numbers, but at the same time, we knew we wanted to capture a good amount of individuals who may be in need of services.
Hey, this is Alexia with Reach St. Pete. I just wanted to add as well, that number specifically speaking to New Vision Behavioral Health's component of it. Doesn't mean that we would cap it at 300 for individuals or families served per year at the hub for mental health services or having individual counseling sessions. But in our partnership with New Vision Behavioral Health, that will definitely cover their portion of the partnership.
Thank you. Thank you both. Any other thoughts, questions, committee members? Kimberly, you're muted, but would love to hear from you.
Sorry. Following up on that question, and I don't propose to be knowledgeable at all about the gamut of mental health services, but has there been any plan, or do you have a plan or potential partnership with any other organizations that might have the ability to provide more of a fuller range of mental health services beyond just individual counseling and group therapies?
Is the question in regards to capacity, us being able to have the capacity to serve the individuals, or?
Well, maybe the capacity, the history, and if you don't have the capacity, do you have an intent to partner with others who might?
Okay. So we have a team of 11 clinicians who are licensed, registered interns, and graduate students who are well equipped to support this grant. They can maintain a caseload of anywhere from 10 to 20. And so just looking at what that may look like, I think with our team approach with the current staffing that we have now, in addition to other clinicians who are constantly wanting to join New Vision, I see us being able to service that under our roof. The collaboration we have with graduate programs and schools who are constantly looking for sites for experienced therapists who are at the end of their graduate program gives us also an opportunity to bring in more clinicians who are fresh in the field, who are ready to go and connect with the community to help us also meet those numbers.
Also, to add to that, I think what you're also looking for is our main focuses would be individual counseling sessions, process groups, and group setting workshops. Those would be the three main focuses. And we are in discussions with other mental health service providers in the BIPOC community that similar to the other application, we couldn't list everyone, otherwise they would appear twice in the application process.
Kimberly, any follow-up questions?
No.
Okay, thank you. Virginia, Natalie, any thoughts here? Carla, want to make sure you got something, we don't miss it.
Well, the only thing I'd like to add to that is that I didn't see a wide range of partners, and I'm just suggesting that perhaps that you could expand that, because you're doing a terrific job. It's just that I thought you needed to reach out to a variation of groups of partners to expand your services. Great job, though. Yes.
Thank you, Virginia. Anyone else? All right. So it feels like we have gone over each of the various applications and we've been able to provide feedback. I want to thank everyone who did apply for the thorough responses and openness to hearing the questions. This has been a really informative experience. I think we, as a committee, may be at a point where I think it's time to make a vote. And so I think we'll start with and maybe we'll take it in the order. I know I threw everyone off initially. I was like, let's throw a wrench in this. We're going Suncoast Center right away. But if we go in the order of ranking, what I will ask is that we move to a vote, and we'll do all in favor, aye, and all opposed, nay, and we'll keep track of those. And then at the end of this, I'm going to ask David and Jocelyn to kind of keep track for me as I will be doing this, and we'll end up with a final grantee. Sound good? All right. So we will start with New Visions of the Well and their submission for the ARPA funds. All in favor? And then also, if you could raise your hand so you don't have to come off mute, it might be easier. Got that recorded?
Give us a second here.
Okay, yep, no worries.
I have.
And again, this is New Visions for the Well. All in favor?
So I have Carrie, Natalie, Marcus, Carla, and Kimberly. 1, 2, 3, 4, 5. Is that, did I miss anybody is in favor of the proposal from New Visions of the Well? I have 5.
All right. And those opposed?
Okay. 1 opposed from Virginia. Got that registered. Thank you.
Thank you. All righty, we're going to move on to Suncoast Center, Inc. All in favor?
Okay. I have 1 from Virginia. All right. Anyone else for that one? Suncoast Center. Okay. We have 1 in favor, Marcus.
Okay, thank you. And those opposed?
I have Carrie, Natalie, Marcus, Kimberly, and Carla. All right, so that's 5. 1, 2, 3, 4, 5. So 1 in favor and 5 opposed.
And Reach Services, Inc., doing business as Reach St. Pete. All in favor?
All right, I see 0 in favor for Reach.
And those opposed?
Let's see, Natalie, Marcus, Carrie, Carla, Kimberly, and Virginia. That would be 6. 0 in favor and 6 opposed to the Reach St. Pete application.
All right, so it sounds like we have reached a grantee in New Visions of the Well, Inc. Duggan, Jocelyn, is there anything more formal that I need to do to make this a bit more official?
We can you can put that, since we've done this, you can do, if there's someone who wants to move to adopt New Visions as the selected grantee, and then take a vote just on that one as the grantee for the process, and do that in a formal motion and a vote from the committee.
All right. Would anyone like to call that motion? I can do it.
Don't move.
Virginia. All right. And do we have a second?
Second.
I second.
All right. There you go, Marcus. You can call the vote.
Righty. So all in favor of to move New Visions of the Well to be the formal grantee for the ARPA funds?
1, 2, 3. I think that's 5.
All right. And all opposed?
I didn't register a vote from Virginia on that one. Was the only person I didn't. In favor or?
Yes.
In favor? Yes.
Yes.
Okay. All right. So that would be 6-0 on that motion, Marcus.
Okay, great. So in that case, New Visions of the Well will be the grantee for the 2023 ARPA funds. And we are thankful again for this process. Thank each and every one of you, committee members, applicants, community members who have checked in to be a part of this process. I want to thank Jocelyn, Duggan, David, and their team, the foundation, for doing a phenomenal job and kind of supporting this. Stephanie, thank you for your guidance and data and research. This has been, for me personally, a really powerful experience. So thank you to everyone who's involved.
Thank you so
And
much,
we just have
Marcus.
one last
David?
technical public comment for items that are not on the agenda. So this is basically for anything under the sun that's not regarding the hub provider selection deliberations. So again, if you'd like to make a comment about something not on the agenda, that would be your time. You could raise your hand, and you'll, again, the 3-minute limit. Okay. Oh, I think we're good. Okay, I'm gonna pass it over to Jocelyn for next steps. If you want me to pull that slide up, should I?
Sure.
Okay.
Just for a second, and then,
And then
so I want to mention a couple kind of logistical next steps, which is that we will be in touch with the selected team in the next couple weeks to begin contract development and kick off the planning period. So I just want to reiterate that this process is iterative, and that's part of the beauty of it. So we knew that, you know, we wanted the application to capture the applicant's vision for this, and knowing that also, you know, it'll take a little time to figure out how it's going to roll out on a more logistical level. I also want to mention that we are so thankful to all of the applicants because you did a lot of work. We know because we developed the application that this was really an involved process, not only about seeking partnerships, but in articulating your vision, sharing the work that you already do, which is hugely important in St. Petersburg and for many of you beyond St. Petersburg. And so we will be sharing the feedback that all of our reviewers left for each of the applications with you. And I also want to mention that, you know, this process will involve a lot of partners. So we welcome you to stay in touch with us and with the selected lead nonprofit as this moves forward. And I want to again thank the city of St. Petersburg for committing to this, for the vision of it, for being open to developing a hub system that is iterative, that does come together as it goes along, which really allows for not only creativity among providers, but really community responsiveness. So I just want to really put a pin on that because that's huge that the city has committed to this and has set the vision for this process. And we are really grateful for the opportunity to work with the city, to work with all the applicants. And I want to thank again all of the committee members who have contributed their care and their expertise and their time this morning and in the past couple of weeks as they've been reviewing applications. So thank you so much. I'll turn it over. Duggan, David, Rose, if any of you have anything to say as we close out. And thank you all again.
Thank you, Jocelyn, and a big thank you to the committee for your time and investment again in this process, and to the organizations, all of them, and all of the partners that work together to apply. This is critical and very important work that's being done in the community, and this is a fantastic opportunity to expand on that and meet additional needs that we know are growing in the community. So thank you all for your investment of time and everything that you do to make our community stronger. This has been wonderful, and also, as Jocelyn said, appreciative to the city for being brave enough to embrace an iterative process like this, and being a model for how this can get done and expand opportunities to strengthen our community, individuals and families. So this has been a great process, and we can improve it by having the input and feedback from the committee members, from the applicant participants. And so if you have things that can help us strengthen our work together and the process, we welcome your feedback as well. So thank you all very much.
You're welcome.
All right, I think that's it, Jocelyn. So we'll thank
I think
everybody.
we're in
and
good shape.
David
Thank you,
will
everyone.
Thank you.
Thank you.
Thank you.
Take
Take
care.
care.